Stay cool. It's 102 out, as the TV tells us. And I want to introduce to you Dr. Alex Coracides, who is an Arizona native, unusual, and attended medical school at Southwest College of Naturopathic Medicine. Dr. Coracides completed an internship at Abundance Life Family Medicine Clinic in Phoenix. He also worked alongside Dr. Siegal at the Southwest Accident Injury Family Medical Center for 5 years, and is now a doctor at Scottsdale Accident and Injury Family Medical Center in Scottsdale. Dr. Coracides has been a member of the Arizona Naturopathic Medical Association and the American Association of Naturopathic Physicians. Dr. Coracides was voted as one of the top doctors for NMD's The Best of Phoenix magazine. Dr. Coracides likes to provide integrative medicine involving naturopathic as well as allopathic care for his patients. In his off time, Dr. Coracides likes to run, hike, and spend time with his wife and 2 sons. Let's give a nice warm welcome to one of our own.
Thank you, Joanne. Can you guys hear me back there?
Yes.
All right, good. Okay, so Alex Coracides. I was a student here at Southwest Naturopathic. Graduated in 2002, so way back. I'm shocked at what the school looks like now. It's amazing. So yes, I'm a native of Arizona, which is surprising. A lot of people that are born here end up taking off, but I did take off for a while, then came back. What I ended up doing was going off to play soccer up in California at Santa Clara University, and came back for grad school at ASU for public health. And so I started working in that field and worked for the government for epidemiology. Was doing a lot of statistics on computers. Didn't really talk to a lot of people as far as patient contacts and stuff. And so it was actually nice to be able to communicate with people, go out to sites and look at some of these outbreaks that happen. But I did not like being in the lab. So I'm like, all right, I do like this whole consultation part of this field. So ended up getting my feet wet in the medicine, worked as a ENT in the ER, did some tech work there at Osborne and over at in South Mountain at Jesse Owens Urgent Care. From that point on, I was kind of to see if I want to go the route of be a DO, an MD, a PA, and I had a friend who was getting treatments. He had cancer and some other health issues along with that, and was getting treatments with a naturopath. And so we would talk here and there and start to get some interest in that. Ended up getting some acupuncture treatment, started doing homeopathy as a patient. And I said, all right, this is something that I do like. And actually, this is what I do with my life as far as living a very healthy life, exercising, dietary, all that. And so checked out to school, applied, and did my 4 years here. During those 4 years, I had an interest also in the allopathic field. I liked minor surgery and stuff. So during those 4 years, when I did my clinicals, I was looking for rotations where I could still implement that and learn more from that. So even though I had a love for the homeopathy, the physical medicine, botanical, I still got my feet wet in the orthopedic world and family medicine. So during that time, which is probably I think where you guys can really benefit from is what I did to get into that, integrate myself into that DO, MD world. Because it's important, and the thing is, the reason why I was so interested in that was because of the clinical part of it. Being able to get my patient contacts, which if there's 3rd or 4th year students in here, you need those patient contacts to get through clinicals. And so one of the offices that I ended up working out of was a MD Mark Siegal, a DO Mark Siegal, and he saw like about 30, 40 patients a day. So I'm like, all right, this is where I'm gonna get my patient contacts. So I ended up seeing like a lot of PI cases, a lot of medical cases. And what's cool is during that time that I was seeing these patients, I would talk to these patients about homeopathy, acupuncture, things that back in the 90s, a lot of people weren't as aware of it, that those therapies are being offered out there. And so start firing me like, all right, maybe if I work within a field like this, I can start to integrate, naturopathic medicine. I just need those patient contacts. So after I finished the clinics there, I would go out and work in the orthopedic field, learn more about how to diagnose, read x-rays, got to sit on some of the surgical procedures and stuff. And then after I graduated, the whole fear, which I was talking with Chris earlier today, is that I was fearful of like the money part of it. Like, how am I going to afford like paying back all these student loans that I have, that I've accrued during this time that I've been at, Southwest. So I'm like, all right, well, I got to figure out, if I work in a naturopathic set point where it's like I'm starting to develop my own patient contacts, it's going to be very slow, and I have a lot of money to pay back. So what I did is I started to put my feelers out there, talk with some of my friends, and that's part of it too, is developing that network, developing the relationship with a lot of other people that work in the medical field, to see, like, hey, what's going on? Is there any offers in here or there? And I did some work with a naturopath right out of school, but I also did a rotation at, Joanna mentioned earlier, Abundant Life Clinic, which was an MD, Gregory Muhammad, and he took on some naturopaths, and somebody had trailblazed before us to start seeing some of his patients. And these are medical cases. And so doing that, I got a little bit of money that I could start to build up. My whole point was of doing that was to build up money so that I actually could start my own practice. But I became very interested in it and started enjoying seeing the acute care, and then also integrating my philosophy into those practices, doing the acupuncture, the physical medicine, hydrotherapy, botanical medicine, supplementation and stuff. So with that, it was a good salary, nothing too big, but I kept in contact with and this is very important, kept in contact with a lot of the physicians that I did rotations with during my 3rd and 4th year, which I would highly recommend, because that's how I was able to get into Dr. Siegal's office, who's the DO, was that one of the PAs that I spoke with that was working out there was leaving the practice. And so he got a great offer with a dermatologist, so he was like, hey, Alex, I'm leaving this office, Mark is going to probably need somebody to run his practice. Would you be willing to do that? So I'm like, oh man, okay. So went in there, did the interview, talked to him as far as like, what that entails, am I competent to do this and all this? And so I got an offer, ended up starting to work there, and it was trial by fire. Basically, seeing one patient after the next, became very comfortable with that. But once I start to develop that comfort in that type of setting where you're like, time management, I'm sure you guys are getting accustomed to, is like being able to spend time with the patient and get to the next, and then get to the next. So with that, I was able to develop, like a relationship with the patients and develop a rapport to where I could start saying, all right, you know what? Hey, what if we try doing like maybe adding some type of supplementation as an anti-inflammatory instead of using like naproxen or Celebrex, some of these other ones that can cause some adverse reactions. And a lot of patients were like, oh my gosh, this is amazing. Somebody's actually offering me this instead of like having to take these medications. So they were definitely more forthcoming to want to do this. So did acupuncture, started doing that in there, and then with time I started to develop my own little practice on the side. We're talking with Mark Siegal about like, hey, is it okay if some of these patients that are cash-based, that are from the PI cases, start to see me medically? And so it opened my eyes to like, as a naturopath, that there are a lot of patients out there that are seeking that type of medicine. And all you have to do is introduce it to them. But unfortunately, because a lot of them have, with the Blue Cross Blue Shield and a lot of these medical insurances, they're unaware of it. And so what I did is I tried to educate them about that and started to develop a practice for myself. So one of the things that helped as far as my financial part was that I had a set salary that I was getting from that practice, and I was able to use that to build my practice outside of that. So through time, I've had a practice on the side, which is a small LLC that I see a lot of naturopathic patients with, but I still do a lot of the allopathic integrative. And from that allopathic integrative, I've actually developed a good network and relationship with a lot of doctors that are in the allopathic field. So I've had experiences working in the ER with them, doing shadowing, going into procedures for spinal surgeries, facet joints injections, epidural injections, stuff like that. And then developing a relationship with people that are doing prolotherapy, PRP. So worked for Siegal for probably about 4 or 5 years, and then got hired on as a medical director at a naturopathic clinic out in Chandler. And that's actually, I think that's probably what the talk I gave before was, integrating the allopathic with the naturopathic. So it was very small, but ran that medical clinic for about 4 years, and then Siegal, the DO, keeping that relationship, hired me on to open up a family practice out in Scottsdale. So with that, we opened up the family practice out there for about 3 years. And then DO came in there and started doing spinal procedures and stuff like that. So I was actually getting more and more experience with all that. So the big thing too with this, I know I go off on tangents, but one of the big things is get out there and just basically develop these relationships, get the experience, be able to show the other physician that you're trying to develop, get into business with, that you're competent enough to diagnose, give options as far as treatment and stuff. But I think when you're out there and seeing these patients in that type of integrative field, those physicians are open to, DOs and NDs are open to that type of medicine because they know patients are attracted to that. So it's a matter of just communicating. So with Scottsdale, I know I went to a number of places, but I love learning. So when I was out in Scottsdale for about 3 years, during that time when I was working with the DO, I started working with a naturopathic only clinic out in Peoria doing IV therapy, treating Lyme's disease, and dealing with a number of different types of disorders. And so the thing is, I wanted to learn more about IV therapy. So I started working with them. What I found out from that clinic is that if you can develop a relationship with a DO or an MD, you could actually start to create an LLC, incorporate them into that, and you can actually get contracted with medical insurances. So like United Healthcare is one of them. I want to say Cigna is the other one. And then I have no idea as far as with the school now with Blue Cross Blue Shield, they still do allow for acupuncture, certain amounts of treatments with that. But if you can establish a relationship with a DO or an MD and you have another naturopath on board, you can apply for a contract with the medical insurances. And the beauty of that is you are a specialist. So a lot of family physicians like DOs and MDs that are just family practitioners or general practice, when they apply for, they pretty much send out a bill and they were looking for reimbursement, the reimbursement rate's not as good. But as a specialist, it's very good. And so that's one of the nice things about it too, being a naturopath, is you're considered a specialist. So something to think about too, and on that, you can ask any questions outside afterwards regarding that. I can give some information on that. So that to me was a gold mine. So I only worked there for a little while, but that was the pearl that I got out of there. And then I went back with Siegal, and now I've been out in Phoenix working with them, seeing allopathic and naturopathic. So at this point, I have 4 clinics that I work at. So I work at a family practice full-time, and it's basically seeing insurance patients, and then we're doing PI cases. But like I said before, it's an amazing salary, and it's helping supply for the stuff that I really want to do as far as the naturopathic. But I can still incorporate my naturopathic treatment protocols into that allopathic world. So I work with Dr. Siegal over Southwest Accident Injury. I work for TRT, it's a low T99 clinic based out of Seattle. And they incorporated a practice out here, so I see the patients that are out here in Arizona. And it's stuff like, and that's the other thing, if you can get your hands into different things where it's like almost like a passive income, you're reviewing charts, you're seeing patients, and then send them off to specialists in that as far as what I'm doing with HRT. It's a nice little supplemental income while you can still work in a allopathic setting or a full-time job. So I got the Southwest Accident Injury, the low T99. I do a weight management clinic where they do some HCG. They do prescription medication as well, like phentermine, some of that stuff. But the beauty of that one is I get to talk to them about the dietary aspect and what I do with my life as far as diet, supplementation, and stuff. And then the last one is I opened up another clinic with a former alumni of Southwest Naturopathic, Dr. Jorge Lopez, where we actually is just strictly naturopathic. And so the beauty is I'm taking what I've done as far as like in that allopathic setting and incorporating using the funds to help supply what I really want to do as far as naturopathic medicine. So I definitely have a plethora of stuff as far as pearls, but I feel like it'd be better if you guys ask questions I can answer. So open, you guys go for it.
I guess mine's kind of like a two-part question. What is a typical week for you, and then also what is a typical day?
Okay. Yeah, so the at the Southwest Accident Injury, it's pretty much 9 to 5. And we see patients from 9 to 12 o'clock, and then from 1 o'clock to 5. And so when we see those patients, it's time management as far as seeing patients. I probably spend a good, with the allopathic ones, about 10 minutes or so. So we'll see about 30 to 40 patients. What I do at 8 o'clock to 9 o'clock, and from 12 o'clock to 1 o'clock, I have my HRT clinic. And so that is where I pretty much do my allopathic stuff. And we talk about, like I said, supplementation. We do things as far as acupuncture. But the gist of it is to go over HRT. So we spend an hour from 8 to 9. I can spend more time with the patients there from 12 to 1. And then on the Southwest Family, which is the new one that opened with the naturopathic, we incorporate the patients during the time that I'm working for the DO. And that's the thing, is like if you can develop that relationship with a physician that allows for you to work there and still see patients within that clinic, it's huge, because you're not paying for any type of having for use of the space. You have a front staff that's taking phone calls as well for the patients that you're bringing in from your naturopathic clinic. But you gotta really work hard on developing that relationship, and that's pretty much what we did. So to answer your question, so yeah, from Monday through Fridays, the Southwest Accident Injury, 8 to 9 is my TRT, and I do opening 12 to 1. And that's not all the time that I'm having those patients from 8 to 9 and 12 to 1. I still gotta give myself like a break. And then on the weekends, I'll do the weight management every so often.
I'm always curious with integrative practices, if you do a roundtable to assess what you're going to do with your patient, or if it's more reading chart notes, like, did you want me to do blah, blah, blah? Okay, got it.
Yeah.
How it kind of goes together.
So at the clinic when I was out, that's strictly naturopathic, when I was learning my IV therapy and stuff like that, we would have roundtables every Wednesday and Friday. And so what we do is we talk about the cases and what type of therapy we were using and whatnot, and then be able to apply that for the patient when they're returning, because we keep them coming in on a weekly basis. And so we just want to make their care a little bit more efficient and stuff like that. So for that, we did that. The one with the family practice, it's a little bit tougher because of time management. So we do converse a lot and consult on cases, but they're more of a, like you were talking about, just a quick 5-minute spiel. And that's the other beauty of being with an MD or DO, is you have that person to bounce that stuff off of. that has that clinical experience with a lot of those differential diagnoses. You start to learn more and more why'd you prescribe this? Because the thing too is when you're working to provide like supplementation, botanicals, and you also got to know what they're taking that may cause some adverse reactions or be contraindicated to. So that's a huge part of that. But yeah, in that setting, it's more of a quick bouncing off. But the other one, yeah, definitely. And I highly recommend the first part where you do have that round table.
So in the family practice clinic with Dr. Siegal, is everything go through insurance through his name? And everything's covered?
Yes, good question. So with that family practice, everything is contracted through Siegal. So I work under Siegal. And one of the things that is a benefit if you do work in a huge family practice, and it can go for NDs, but with that integrative field, is they'll have the funds as far as payment for your malpractice, which I get for my conferences, for travel, for expenses, room and board, all that, my licensure, my certificate to dispense, all that's covered with those guys. And so you get that benefit, and then the insurance part of it, I get to see those patients that are insured because they are insured on him. Now, what I learned from that other clinic when I was part of the partnership there was that I would be listed under United Healthcare as a practitioner that patient can see. So that's the beauty of that, is you'll be able to have your name out there. It's not just about being on the network with, like Naturopathic, but also being in that network that's available for people that are looking at DOs and MDs, and they see that there's a naturopath on there. A lot of people are like, oh, that's where I want to go. So we would open up those patients that wanted to see me as a provider. With the contract, you got, as a specialist, you're going to spend a little more time, which is what we like to do as naturopaths. So I afford like a good 30 minutes to an hour long visits. Compared to an allopathic where I'm seeing somebody for an acute case, it's 5-10 minutes. It's quick.
Okay. You get your name on that screen because you work with another naturopath and a DO, the LLC.
Yep, and that's the thing. You can't get contracted as a specialist because they're looking for a practice where there's a couple MDs in there. If it's just you alone, it's you and a DO, it's not going to work.
Okay.
If you do have another naturopath with you, and a DO or an MD, yeah, then you can't get contracted.
Okay. So
But it's a long process. It's not like I'll just sign up and then next month. No, it's like a 6-month process of trying to get approved. Then you got to, every 3 months you got to go in there and actually fill out another form just to like a reapplication. Because if not, then you can lose them, and then you got to start all over again. It's long. But yeah. Can I answer your question?
Yeah, thank you.
Any other questions?
Yes, I have one. As far as being considered a specialist for insurance purposes, of course, as far as portraying yourself as a physician and in the allopathic world especially, you have to have certain additional educational requirements in order to be considered a specialist. So how would that necessarily affect us as naturopathic physicians if you're saying that classification could be based upon who we're working with in practice?
Yeah, so it's I guess I should better explain. So even though it's the DO that was contracted with United Healthcare at that practice out in Peoria, the naturopathic clinic, he was family practice. However, when the other doctor and I applied, we applied as naturopaths, which is considered a specialist.
Okay.
So I didn't really need to be like with an orthopedic to actually. And you're right. If it was a case where I was actually going into family,
Exactly,
consider somebody family
a
medicine.
PCP versus an orthopedic specialist for like sports medicine.
Correct.
things like that. It's
Even
not
as a
the
family
same.
practitioner, you're going to have to get those credentials to do that. But that's the beauty of it. I mean, as a naturopath, you are a specialist. This is what you specialize in. So you can apply those type of treatment protocols like acupuncture, hydrotherapy, all that.
Absolutely.
And the beauty of that too is the coding on that. And if you have questions later on, you can definitely help me out with that. But with the coding on that, the coding is awesome. The reimbursement on that's so much better than just sending out a bill for like a consultation. You're actually being able to spend 30 to 60 minutes. That's what they're expecting of you as a naturopath. So.
I'm confused. But that's okay. You're gonna unconfuse me.
All right.
So based on what you're saying about contracting for insurance, if you have an MD or DO, family practitioner, with more than one ND, not just one ND,
Correct. It's
you
got to
have
be
to have more than one?
Because it's considered a practice. Like, if you look at an orthopedic office, it's going to be more than one. If it's a practice of orthopedics, it's going to be an office more than just
Okay, so you have to have two or more,
Correct.
plus two or more NDs, plus a general practitioner, family practitioner. What if it's a specialist, orthopedic surgeon, and two NDs? Would that work?
Well, and the thing is,
See,
yes, and that's fine. The goal, what you're trying to do is not to go towards the orthopedic part. You're just trying to get almost like a suit. It's like a glorified PA, or you're trying to get somebody that's actually going to give you coverage so that you can actually be contracted with that insurance for naturopathic medicine, not for orthopedic or any other type of specialist.
So it really doesn't make any difference what kind of doctor you go through.
Yeah,
as long as you have two or more NDs in that office.
Because the thing is, they're taking on the liability with them taking that, being part of that partnership.
I understand. Yeah. Okay.
And that's the thing, is like it goes back to that whole just developing a good relationship, with the other physicians that you're out there with, because if they can trust you, then they'll be willing to do that. And it's not like they're putting their name on it. I mean, they're getting a benefit also financially from that too.
I don't want to steal the questions from you guys, but how did you create that trust relationship with the MDs, with the DOs? How did you do that?
It's just, I think part of it was, for me, was to get out and actually just start getting my hands dirty in the different fields. Like doing the trial by fire, like seeing patients and learning about the differential diagnosis of orthopedics, the differential diagnosis that you're going to see in acute care, being in the ER and stuff like that. Learning that so that when I was with those DOs and MDs, they knew I was competent enough to go out there and make that diagnosis or treat them. So that's the other part of it, is really get out there and put yourself out there. It's a little fearful, to be in that type of setting, because you're curious if they're going to judge you for that you're a naturopath, you don't know this or that. But I think that's the thing that you can surprise and shock a lot of people, is that if you do go out there and see these patients and have that contact with these patients, you can show them, like, hey, I know exactly what you're doing with you. This is the treatment protocol. They're going to feel comfortable with you to see those patients. So that's pretty much how I developed that relationship. And that's why I think it's during that third and fourth year, go out, and if there's a clinic that you're kind of interested to get into as far as the allopathic world, go for it. Just approach them. That's how I got into one of the orthopedics. So I just say, hey, listen, I knocked on their door. I want to learn more about orthopedics and what you do here. Even though I didn't want to go in that field, I just wanted to learn more about it because I do like physical medicine. I did that, and that's actually, they brought me in and we started using, he never used arnica before. He started using it on all of his post-care, stuff like that. And even that little bit was cool to see him actually incorporate that into his practice. But I also got a chance to speak with the patients, and then he saw that rapport developing between the patients. He's like, oh, this guy could be an asset to this practice. But that third and fourth year was critical to get some of those rotations developed. Learning more about the allopathic world. But I know I get criticized because it seems like I'm going more in that direction of allopathic. I'm not. I'm using it as a means to still be involved in medicine, but to support what I want to do naturopathic. If that makes sense.
So do you know much about, kind of keep on going back to that LLC?
Yeah.
But is that everywhere, or is that just Arizona? That's how they do it in Arizona.
As far, like having the
Yeah,
like
the
a-
insurance coverage.
Yeah.
Is that just like an Arizona thing?
I don't know. It's a good question. Yeah, I think in Washington it is, but I don't know.
Just
I can only speak for Arizona.
Okay. How would you find that out if you want to know if a certain state does do that? What's the question you ask?
Yeah, I mean, I could find out for you. I know the person that does the billing had set it up for us over here in Phoenix. So, but yeah, I'm not too sure.
And you want which state?
I'm debating which state, but either Utah or Idaho.
Okay.
So,
Yeah.
but Idaho just got licensed, so I don't know what's.
Yeah.
No, it's licensed.
Yeah, just got licensed.
Just got
so.
Yeah. It's
So-
it's huge. I tell you, it gives you a chance to market and network out there to get patients to come and see you as a naturopath, and they're allowing for you to see these patients for, they're expecting actually for 30 to 60 minutes, which is what you want to do. You know, when you want to gather the whole picture on the patient, you know, to come up with a treatment protocol, and I enjoy that. And so I get, that's the thing too, is I like having that acute care part of my life, and then also dealing with the part that I really enjoy, which is the naturopathic. But I'll check on that for you. Yeah.
No, go ahead.
No, go for it.
No, go.
That was me graciously saying, take the floor. You're allowed.
Okay, so I had a thought of like a company as big as Banner Healthcare.
Yeah.
Up in Utah, I worked for Intermountain as a nurse, and I got really good relationships with some of the physicians there. And I thought about going back to some of these physicians and kind of having that discussion with them. In a company like Banner, you're not going to have a hospital rights, but in a Banner Associated Medical Clinic, what's your thoughts on will there be hurdles there, or do you think it's possible?
No, definitely be hurdles, and that's what I'm trying to get rid of is some of those hurdles as far as letting them understand. Like I have the experience as far as dealing with these type of patients. I do have some experience in the allopathic world because I was working on something out in Gilbert with the same thing. Developed a relationship with the VP out there, and so we were talking about incorporating into that hospital a naturopathic program. But yeah, it's just getting out there and like doing the hard work.
Okay. So if you know the physician and they're good with it, like a big company like Banner, you think it'll still be a possibility?
There's a lot of skepticism to it. I think for those hospitals. But I think if we have a lot of those naturopaths out there that are showing them that they're capable of doing that in that type of setting, I think it'll definitely open doors. And that's the thing is if you can lay down the groundwork and be the trailblazer out there, yeah. But it really is all about developing that relationship with those and gaining that trust. I think that's what's worked for me, is being able to go into some of these spinal procedures and not doing the procedure, but actually being there and having them consulting on certain things that they can do for post-care, pre-care, pre-op stuff. So, yeah.
Thank you.
Oh yeah, no problem. No. All good.
So do you, with your education at SUNY, do you feel competent to kind of act as an allopathic provider?
It's a good question.
We're stretched so thin with a lot of different things. I mean,
Yeah.
what's your
Yeah.
thoughts?
Yeah, that's the thing. It's like I definitely live a very naturopathic life as far as what I do diet-wise, supplement-wise. Just I talked about exercise a lot. But I wanted to get that experience within that, and that was my goal, was to try to develop that. Now, to answer your question, I still felt very green as far as the allopathic world. And so I wanted to incorporate myself into that, and so I did. I just started knocking on doors and trying to get in there and learn about what their differential diagnosis of, a lot of those acute care, but also some of the chronic cases too. And then once I established that, I felt more and more confident. And then I think when I first came across with the DO, Mark Siegal, to get that position at that office. He could tell that I was ready to go. But a lot of it too, and I'm sure you guys are aware, like being third or fourth year, is like, you're just kind of thrown out there. It's like you gotta prep yourself. And I think the contact with the patient, you learn a lot from the patients as well. But developing that relationship and learn from the patients, studying beforehand on certain cases and stuff. The nice thing is you're at a little bit slower speed with some of the naturopathic, I think, rotations. The allopathic, it's just like they just throw you in there. But I would actually go home and study some of those cases that I had no idea what this was about as far as allopathic. But I think once they recognized it, I was starting to catch on. Like, okay, you can handle it. I'll go see this person or that person. So yeah, I did definitely feel a little bit green, but I put myself out there. Yeah. And don't be afraid to fail, as far as going out there and doing that. I mean, you just got to pick yourself back up and realize when you made mistakes and adjust on that, and then get back out there again. So. How we doing? Good?
Yeah, 10 minutes.
Okay, let's see if I wrote something on here. Anyway, is it one of the big fears you guys had as far as like with the financial part of it, right? Was that like leaving school and accruing all these like bills and stuff? Yeah. No, I know. And I had some friends that were, graduates with me, and I was actually, while I was trying to get hired on and working over at Muhammad's office, doing some rotations there, I was working as a trainer just to get some money. But what I realized is like, okay, well, some of these other doctors are looking for people that are going to come in and put some time there. Might as well do something that's going to be in the medical field that's going to pay pretty decent, and then start to use that money and save it to start building my own practice. One of the big things too that helped a lot, give advice as far as like loans, student loans. I know you get a certain amount that comes in that you're going to utilize for school and also for like room and board, food, all that. I would save a portion of that and just put it into savings or invest it, and then after school start to pay back those loans quickly. So I got to deal with that also. That helped a lot. But yeah, don't worry about it. It's whatever as far as the financial part. It's putting the time, the effort into it, and just getting out there and doing it. Because you guys have a lot. Trust me, you have a lot to offer, and there are a lot of patients out there that are like vying for like naturopathic care. They really are.
So with this Dr. Siegal that you were working with, how do you approach that conversation of what you expect to get paid? Like how does because how do you know how much you're worth?
Yeah, I was lucky. The PA kind of gave me an idea of what the salary was, and he was telling me this is what you need to come in with. And the thing is, my resume didn't have a lot on it, but he knew that I was really good with the patients when I had done my rotation. I did 2 rotations through there. And so he knew I was really good with the patients, and so I came about where a little bit below where the PA was at. And what we did is I would highly advise this too, is get a contract set up so that you guys can do a go back and look and see every 6 months to a year, where you're at. And because the thing is, as the practice starts to flourish and you start to bring in patients and you're seeing patients and the DO or MD stepping out to go do a surgery or do something else for a while, you gotta get reimbursed for that too, that time. So that's what we did is we reevaluated like after 6 months to a year, and then go back, and that's how I started to recruit more and more from that. But it's a tough conversation. You just gotta, if you can be able to talk to the person that was working there before, if you go the route of working with an ND or DO, and then find out where they were at, and then that's where I would probably or just ask around. I know it's a hard question for some people to say, hey, how much you like making, but it gives you something to start with, negotiating wise. But definitely get a contract to where you guys have that in the contract that they reevaluate where you're at within a year. Because if not, they're going to just the DO I work with is a great guy, but he's got a lot of things going on too. So he's not going to think about it oh yeah, it's been a year, we need to talk about where you're at, as far as that. And I keep mental notes like how many patients I've been seeing today, that kind of stuff. And then I just give myself enough support to walk in there and say, hey, this is what I should get as far as increasing pay. But I asked for malpractice. I've worked at 2 clinics that did that, provided that malpractice, which can be about almost $3,000 a year, and it's good coverage for like PRP, IV therapy, stuff like that. And so it allows me, I feel comfortable, that I'm not taking on that. And the other thing too with the DO and MD is they do have an umbrella policy, which will help as far as coverage too. But I asked for that, got the licensure and all that. Especially if you're working for them, they're going to want to make sure that they can keep you in that clinic. And so the more valuable you are to that clinic, the more they're going to be willing to pay you.
Have you ever found yourself in a position where you were navigating a negative perception that you were coaching patients for an outside naturopathic practice, or did you find that you were such an implicit value to that integrative practice that it never really came up?
So you're saying
As far as motivation for getting into the integrative sphere, it's definitely something that I'm very, very interested in. But again, as we're trying to change the conversation about what naturopathic medicine is, have you ever had to navigate a negative relationship where maybe an allopathic physician would be perceiving that you are coaching patients for an alternate practice?
Yeah. Oh yeah, you come across that.
How would you navigate those conversations?
I think the thing with that is that's where the rapport with you and the patient is really important.
Absolutely.
Because they're going to advocate for you and say like, you know what, Dr. Alex was like offered this. I'm doing really well. I just had something the other day with adrenal fatigue and getting the cortisol manager and looking at the cortisol levels and stuff like that. And their sleep is better. The stress levels are definitely able to deal with stress a lot better. That type of stuff is important because then they start to speak out. And once they go, I don't ask for reviews, but sometimes they'll go online and do those reviews, and they'll see that as well. But you're going to come across it. The big thing I think is you'll have some allopathic physicians. This is at the early ages or stages when I was going through this that were
exactly like just that initial
judgmental.
phase of being able to get into.
Yeah, and that's where I think when I did that rotation I was talking about earlier is that once I spoke up about it on using this homeopathic remedy, and the patient was like, "No way, that sounds awesome," and I was like, "Oh, this could be good." I'm in a place where we're working on a personal injury case, and I'm actually offering this, and the patient is all for it. And then I start to realize there's a lot of patients out there like that were just like, nobody's speaking up for this. They want to write me a pain med or recommend going in for surgery or something like that. I'm just offering different type of treatment plans and stuff. I mean, there's going to be times where you really do need to go that route, but patients are willing to go the other route too, depending on what you're dealing with. I mean, there's going to be certain cases where somebody's got a complete tear compared to somebody has like an interstitial tear where you can treat with some type of hydrotherapy. But yeah, you're going to run across it. I think if you develop that rapport with the patients, they'll speak up for you. And that's where I think we have in the family practice where we have our names and patients will request you, so they'll put the name on the board, and then then you go. That's automatically your patient. So there's days where it's like it has my name on there. Siegal doesn't have one on there, so he knows like, all right, these people want to see me. Yeah.
Well.
So that may be one way to do it too.
Okay.
Is to say, if you want to see me in a week, just request me and I'll come and see you.
Absolutely.
And then I will put your name out there so that when the doctor sees, oh, okay, I apologize, I didn't get your name.
Lauren.
Okay, so when he sees Dr. Lauren, they're requesting that. That's huge. They'll see that stuff. So, yeah. Does that answer it?
It does, yeah.
Two more minutes.
students to do rotations with you since you?
Yeah, absolutely.
Okay, there
Absolutely.
you go.
So we do a lot
There's
of.
an opportunity.
We do, yeah. You'll get it if you come to where I'm at. You'll get a chance to see both the HRT. You'll get to see the allopathic, like minor surgeries, physical medicine, and then it's just strictly naturopathic part of it too. So, yeah, for sure. Anybody's more than welcome to come through there.
Well, let's make sure they have your card.
Hopefully that answers some of the questions on it. But Joanne has my number. You guys can get a hold of me if you have any further questions. I'd be happy to answer those for you guys. I do have like a couple cards here for one's the naturopathic and the allopathic, but it is the same office. So if you call either number, it's going to go to me. So just do Joanne.
Make sure they get them.
Thank